Welcome back. We are here inside the session, joining you for another episode. This is episode 4. We are really proud of these episodes because we got some numbers. We got some numbers, y'all. For those who are listening, paying attention, we got numbers, and the numbers speak for themselves. That's evidence that what we're doing is working. It's helping, and we want to continue to do that. So on today's show, we're going to continue to work. We're going to continue to help by giving you new insight, new information related to social justice. My name is Dr. Jason Branch. I serve as the co-host of this podcast, as well as Dr. Fisher. Dr. Fisher, take it away.
Hi, I'm Dr. Cheryl Fisher, founding director of the Alliant Masters in Clinical Counseling campus here at Alliant University. And we are super excited today to have our guest and one of our talented faculty members, Dr. Ashley Diaz. You know, one of the things that when we were talking about what kind of topics that we wanted to bring in the session, we talked about the fact that accessibility and defunding and all kinds of elements are really impacting our field, and it's for real, and we like to keep it real. So we invited Dr. Diaz to tell us a little bit more about social justice and mental health and bring to the table her experiences, both professionally and maybe personally. So, Dr. Diaz, would you like to tell us a little bit more about you?
Yeah, of course. Thank you both for inviting me. I'm happy to be here. My name is Dr. Ashley Diaz. My pronouns are she, her, ella, and I graduated from my master's in mental health from the University of Texas in El Paso. So it is a border city in Texas. I went on to get my doctorate in counselor education supervision from Penn State University, and I've had the pleasure of just working in a number of settings in the clinical counseling field, whether that be inpatient, partial hospitalization, outpatient centers. I worked at a high school setting, so within a school district, as well as a career counseling center at Penn State. So I've had some really great experience just working with diverse clientele and diverse populations.
Thank you. We're happy to have you. So, one of the things that I like to do is I like to pull up current events. Like, how is this relevant? How is what we're going to talk about today impact us in real time? So, here are just some of the stats that I pulled up just this morning, as a matter of fact. So, about 29% of U.S. high school students report poor mental health most or all of the time in the past month. 19% of US adults have been diagnosed with depression, and only half are receiving treatment. Oh, I just heard this just today. I was talking to a colleague who works inpatient, and she was saying that because of the defunding of all of the programs and insurance, inaccessibility to insurance, inequities around insurance, people just aren't showing up even for the care when it is available. Burnout among mental health professionals is increasing exponentially, and we already have a shortage. And then, of course, policy rollbacks disproportionately are affecting low-income, BIPOC, rural population. And then finally, only 82% of adults report receiving needed social and emotional support, highlighting this ongoing crisis. So tell us what you know, Dr. Diaz.
Yeah, I mean, it's a very heavy topic, and it's, I think, very hard to kind of talk about all of the different angles because you're right, there's just so many ways that different people are being impacted. But like you were saying, there's been a long history of systemic inequities within our field that ultimately lead to people being scared to reach out for help. Maybe they have experienced stigma and they don't trust healthcare professionals for help. So there are many mental health disparities that are directly related to these systemic inequities that you talk about. Kind of over the years, I've seen there's like themes and patterns in the research. And so one of them is like that lack of high quality care by healthcare professionals. Many times the lack of training for healthcare professionals in working with diverse clients can ultimately lead to kind of like those harmful experiences within those relationships. Also, the high cost of high quality care, lack of access to affordable healthcare insurance or affordable mental health care in their area, even for rural communities or low SES status communities. And the other one is just the additional support services needed as well. I kind of always talk with my students about how the lack of childcare services, transportation, even just mobility kind of concerns and access concerns at the actual facilities, all of that can lead to people having less access to these types of facilities and mental health care, in addition to a lot of the lack of funding. So not only are all of these kind of inequities already present, but then you also have the lack of funding for the very few facilities that are available for clients.
Thank you for sharing that. And it's so honest and it's so real that we're all impacted by this directly or indirectly. And I'm curious for the listeners, if we could talk a little bit more. You mentioned the stigma. There's a stigma there. There's some stereotypes, some biases, some inequities. If you could share with us a little bit more for those who may not be aware of what these things are.
I think when I think of stigma, it kind of brings me back even to my own community, right? Growing up as a Latina and in my own Latino community, I often saw that maybe conversations around mental health were harder to have. And maybe it was just, maybe lack of knowledge or lack of understanding of what all that meant or lots of pressure, right? As well. And I think it also stems back to that mistrust of the healthcare system and healthcare professionals and perhaps even if you are going through something hard and experiencing kind of like a mental health condition, it's hard to ask for help because you may have been turned away or you may have, had a very negative experience in the past asking for help. And so that makes it even harder. I think it's growing in awareness. I think more people are talking about mental health, which is wonderful. But even then, people are afraid to have these types of conversations because they're worried about what others might think of them. They think less of them when in reality, everyone kind of may be struggling with something in different ways. And lots of that really stems from kind of these inequities that they're experiencing. So it's all really interconnected, and stigma is so real. But I think people don't talk about it enough, and that is like a direct connection to why people don't seek out the help that they need.
So it's interesting when you talk about stigma. I can recall talking to some friends of mine actually who talk about that in the population, the culture, the climate, familial climate, that it was seen as a weakness. It was seen as detrimental. That don't you dare tell people. Don't you dare let out that you're having problems.
Mhm.
This could really have significant implications on us in our community. So in addition to societal stigma, community stigma, familial, just like don't you no, kind of we don't talk about Bruno, right? We don't, right? So there's that element too. And how do we integrate this real safety, not just, me as a white clinician saying, oh, it's safe. It's safe for you to come to my office or it's safe for you to seek services. And maybe it's not safe in the community. So can you speak more to that maybe?
Yeah, these are tough questions, I think. But it's a really
What?
great question. I think they're tough questions because I think it's very different for every community on like what might be safe for them and what they actually need. But you're bringing up, Dr. Fisher, something really important where I think ultimately the reason why a lot of these conversations are not happening, or maybe people feel like they have to silence themselves and kind of experience that stigma even more, is because of the lack of resources in many of these kind of communities where maybe they have experienced historical marginalization, systemic oppression, right, where they have less access to resources. And so this lack of resources where maybe you have, a mental health counselor in a school system or in the community who's talking about or normalizing these types of mental health conditions and talking about these things in ways that kind of build awareness, build knowledge, kind of build skills on how to handle this. Unfortunately, a lot of this isn't happening in underrepresented communities. And so that ultimately leads to more stigma because people do feel like they have to silence that within themselves because they don't have access to, or even just representation of seeing other people in these fields where they can go to and ask for help or ask questions.
So this a lot. We just started. We just we just got here and we already deep. So for those who aren't listening and for the newbies, I want to share the house analogy we use on the show. The house, there's three parallels: the attic, the living room, the basement. The attic is where we spend most of our time, which is in our head. The living room is where we are presently, which is hard to do because I'm focused on the future and the past. And then the basement is where the magic happens, where all the stuff that's happened to us, we put in the basement, we leave it there. And we're in the basement already on this show because of what you're sharing. Since you gave us permission to be here, let's go a little bit deeper. I'm curious with everything you're sharing and everything that's come up relates to marginalized communities and the stigma. I'm curious, as a person who identifies as Latina, you overcame all of these challenges to be where you are in this profession. How? How did you do it? And even with your family background, like all the stuff you talked about, you overcame it to be here. How is this possible? You mind sharing with us?
Yeah, I overcame it, but there were definitely many systemic barriers that I had to, cross and kind of challenge in order to be here, you know? So I appreciated that you saying that, Dr. Branch. I worked really hard to be in this field because I saw what a difference that I could make in my community by, having that representation of, having a mental health counselor, but also, a professor in this field where I could, talk to students in my community, talk to students who were out there working with bilingual clients and Latina clients. And I worked hard because I knew that that was important. In addition to that, there were so many barriers that were there that I didn't think necessarily had to be there, right? And it makes it really hard for Latino communities to, well, I don't want to speak for the entire Latino community. I'll speak for myself, right? As a Latina, I saw, in my community how hard it was to even get access to a school counselor, right? Or a mental health counselor, just because of the lack of funding, lack of resources, right? And so when I was struggling with things related to my different intersectional social identities or wanting that sense of belonging and that sense of community and kind of coming to terms with, I have these differences, I have these, marginalized identities, but I also hold privilege in different areas. I wanted to have those types of conversations. I would have loved groups that kind of, had those spaces where we could have those open conversations. But unfortunately, that wasn't the case, right? I didn't have some of those spaces. Then going into, working at a psychiatric hospital and working at these different centers where I saw again the lack of resources or even just the lack of knowledge and awareness of how to work with Latino communities. There was very few bilingual counselors, bilingual psychiatrists, even translators. There was a lack of translators at these spaces. So I just kept seeing the systemic inequities. And I think that really kind of ignited that passion to want to help. But it wasn't, I think that's where I'm saying it wasn't without all of these barriers that I had to cross in these spaces where I felt uncomfortable or I didn't feel seen. And I wish that we didn't have to go through that struggle to get here, right? Because yes, we can work hard and we can pull ourselves up by the bootstraps and get there, but I don't think we should have to do that. And we shouldn't have all these barriers that we have to cross in order to get there, right? And yes, of course, everyone has barriers, but I do think that historically marginalized communities just have way more barriers in front of them to get to a spot where they can, pursue higher education.
Thank you. Thank you so much for your authenticity, your transparency, you sharing your truth, because this is the space for it. And to me, what I'm hearing is because of the inequities, because of the barriers, because of the stigma, because of so many things, you saw it and now you're in a position to change it. Like you're doing your part to change it where I don't see it, but I can do something and you're doing it. And to me, big picture, there are people, whether you are aware or not, that's watching, that's seeing because you were watching, you were seeing. And to see you, to be in the position that you're in, your presence alone changes things. But
I
that's
appreciate
one
it.
part. You out here doing it big, okay? You're not out here just doing regular stuff. You're doing it big. I gotta give you love, Dr. Diaz. Got to, because we family. We family. So
Right.
it speaks volumes. It may be your norm, like you're accustomed to just moving and navigating in these places, but it's not the norm. In my opinion, it's not the norm. So for you to do it and for you to be on this side and continuously changing the culture, changing the lens, changing the identity of our profession, it speaks volumes. So thank you for your truth. Thank you for sharing it here, because what these lived experiences that you share can impact people in ways you never know. So I'm so thankful that you shared it, because you just never know who's listening. It could be a younger version of you that's tuning in, that's curious, that you were able to plant a seed and impact for them. Who knows? They may be one of your colleagues later on. Who knows?
I mean, yeah, it's my favorite part. I think, connecting with colleagues who are part of the Latina community and they're doing such important work out in the spaces that they work in. And, sometimes it can feel isolating and other times it can feel really empowering that, we might not be able to change the world, right? But we're making small social changes. And again, that's my favorite part, connecting with students who are bilingual, working with the Latina community. And they're doing their thing and they're coming and saying, "Hey, what resources do you have for me?" I'm sharing resources with them, but they're also sharing resources with me. And, I'm learning from my students and the work that they're doing. So I think that's the most rewarding part where all of us have community in this, counseling field. And although, it can feel isolated when we're in the session with a client because it's just us and the client, but we're learning from the clients there with us. And then outside of that, when we're going to conferences and talking with each other, we're knowing that all of us are in this together.
And, Dr. Branch, we also know about Dr. Diaz is that she is a fantastic researcher. and doing some really amazing work out there. And so we know as counselor educators that our students are, some of them are very timid about research in general. And Dr. Diaz is out there doing some really great stuff. Would you mind talking a little bit more about how you got into research and maybe some of the things that you're doing, making this great impact on the field?
Yeah, I have to be honest, I didn't really see myself as a researcher, but again, I think that goes back to maybe the internalized kind of thoughts that I had of I don't see anyone who looks like me, being a researcher or researching the things that I want to research. And so I almost internalized this thought that I don't think I could be a researcher. I don't know enough about it to, pursue research. But in my master's program, I had this wonderful mentor who really focused on diverse research. She invited me to just be on her research team and be a part of research. And I think that is wonderful in itself, where you kind of open up opportunities for students who again may not even see themselves in that way because they may just not have had like a mentor who maybe pushed them in that way, or they may just not know about it. And so that opportunity in itself really helped me see there are different things that I can explore and be. I don't have to limit myself to, what society has told me that I should be or couldn't be. So she really invited me into that field. And that's what kind of sparked my interest in pursuing a doctor in counselor education, because I knew that I could maybe do research that was important to my communities. One kind of article that I've written with other colleagues is on radical empathy. And if we think of empathy, lots of times we think of empathy as, putting yourself in another person's shoes, right? But when we kind of dug deeper into the research and we did a kind of a research project with high schoolers, right, who kind of were engaged in advocacy, we realized that we wanted to go beyond that traditional definition of empathy in the counseling field. My colleague kind of coined the term radical empathy. And, it's also shown up in other research as well, but we kind of saw radical empathy in our research paper as a way to tap into critical consciousness, right? And being aware of the context, the historical context, social political forces, everything that kind of makes a person who they are. And in order for us to really engage in cultural humility and understand a person's experiences, we have to know more about them and their unique cultural experiences. Also knowing that there's a limit to that, right? When we think about cultural humility, we might be able to relate to some experiences. We might even share some similar social identities, but we will never truly fully know a person's full experience because they have their own unique experience of the world. And so we kind of created the spectrum of empathy from that traditional form of empathy all the way to kind of this radical empathy. And it takes time. It's a skill, it's a practice that we have to continuously engage in, kind of like the multicultural and social justice competencies. We're always kind of learning how to be better and engage in that radical empathy. But that's kind of one article that I'm really proud of that I worked on with a few colleagues. Another article is on how school counselors can engage in culturally responsive practices with kiddos, how to incorporate play therapy in culturally responsive ways. So, engaging in games and practices in session that incorporate the client's actual culture. So not just having, those traditional games that we kind of think of, Jenga and kind of card games, but also what is the culture of my client? What are the games that they like to play in their homes? What are some traditions that they hold in their home? And how can I bring that into session so it makes it more culturally responsive and they feel more safe and open to kind of talk about their family experiences and cultural experiences. Anyways, I kind of just saw how research can open up ways to learn more about what's going on in the field, write about it, and then share that research with other counselors who can then go and read that literature and maybe take some of those ideas and incorporate them into their own counseling relationships.
See,
Ooh,
Dr.
Dr.
Branch?
Diaz.
Look at that. Look at that. I told you.
Ooh, Dr. Diaz. Come on now. You can't be coming on this show cutting up like this. We ain't gonna have you coming in here turning tables over, okay? In the most professional, respectful way possible.
Y'all are too sweet. I know y'all are doing great work as well, though.
Hey, no. This is about you.
It's
You
about
gotta take
you.
this. You gotta take this, Dr. Diaz. You gotta take it. You gonna take this love. So I'm curious, as a researcher, because it's stamped now, it's official, okay? Imposter syndrome has no room for what's going on in here because you have spoken on it. Not just the research itself, it's the work and the impact because you're seeing the outcome of the work. And you brought up two really important topics that I want to dive into because there's many people that listen to this show who are not aware. And that's part of this show is to help people with awareness. So two of the things that you brought up I really want to dive into is cultural humility and cultural responsiveness as a clinician. If you could tell us more about that, because there's different types of people listening. And I feel as though those two terms are really big, especially now. And a lot of people may not know or understand it. So could you break that down for us?
Yeah, and I would love your help as well because I feel like they have those specific definitions, but I might not get it completely right. But I know that cultural humility is really tapping into our own awareness, our own attitudes, our beliefs, our own cultural understanding of the world, and ensuring that we're using that counselor reflexivity, like learning more and reflecting about who we are, and then how that ultimately impacts the counseling relationship, right? And using that humility, being humble, and knowing that we don't know, right? Like understanding that we don't know everything that the client is experiencing, and that's okay. And we want to ask and we want to gain that understanding by learning more about the client. So that is how I kind of conceptualize cultural humility. But I'd love to hear y'all's thoughts on that.
I like to keep it simple. What you got is phenomenal. Okay. We're not looking for a book definition. We're looking for lived experience. Like you're talking about a lived experience that helps humanize it. You're humanizing this. When I think about cultural humility, is getting a PhD in your client. That
Mm,
means I need to learn everything about, I don't know anything about this client. I need to learn as much as I can about them. And that represents that client. You said this a little bit earlier, and I got to highlight it where, yes, I may be a part of the community, but I can't speak for the entire community. I'll speak for myself.
hmm.
That's cultural humility. Even being a part of the culture. I just want to talk about it. Listen, I
Yeah,
just
of
want to
course.
talk about it. So that's an example of the humility, knowing I don't know it all. I know a lot, but I don't know it all. And I'm willing to humble myself enough to learn. That's what I picked up. And that's exactly what you just did.
Mhm.
Absolutely. And that's the thing, like, I don't like to make assumptions. It's really important as counselors that we don't make those assumptions, that we don't kind of fall into making stereotypical assumptions about our clients and what we think they might like just based on, social identity that they share with us. I think that's so important.
Let's dive into that because that sounds like
Mhm.
the cultural responsiveness. So
Right.
for
Mhm.
clinicians, for new clinicians, so some of our students, people who are interested in getting into professions, people who's been here for years, how
Mhm.
can they begin to be, consider other cultures, especially if you don't have to? Because typically as clinicians, we don't have to consider anything, if I'm being honest.
Mm.
Mhm.
Remaining safety, remaining that are keeping our clients safe, but outside of that, it's not required. So how can a astute clinician, someone's been in the game for a long time, somebody that's new, how can they begin to adapt this cultural responsiveness to working with their clients? What does that look like?
Honestly, I go back to our codes, our competencies, our guidelines, right? So our ACA guidelines, our multicultural and social justice competencies, they all ask and request and demand that counselors really engage in this cultural humility and cultural responsiveness, that we tap into our awareness, our knowledge, our skills, our advocacy and action, not only in the counseling relationship, but also outside, right? Like in society, in public policy, in the world, right? So we are supported by our competencies and our ethical codes, right? To ensure that we don't do harm to our clients. That really is at the gist of it, right? Like if we are not understanding our clients' diverse worldview, their diverse background, who they are as people, right? And what makes them who they are, then how can we really actually be in a counseling relationship with them and help them, right? But I think it starts like even since the beginnings. One protocol that I like to do even in the biopsychosocial interview, right, when you're getting to know the client, there's a lot of great research. One that I like to use is a culturally centered interview protocol. It kind of walks you through some specific questions that you can maybe ask just to get to know the client a little bit more. Like, what is your culture? Tell me more about your family traditions. Like, questions like that that you can just kind of embed in that biopsychosocial interview. So not only are you learning about, them physically, about their mental health, but you're also learning about like their cultural wealth, right? Like what do they have that they want to bring to the table and that they want to share with you as a counselor. So that starts kind of there. And as they kind of open up and feel safer, that's where I think then interventions can kind of be more culturally responsive, right? That's where you can incorporate some of their culture, whatever they feel comfortable sharing with you. You can see how can this go well with the treatment plan, with what we're doing as mental health counselors. And I think all of that again is interconnected. I like to use that word a lot, but it's the truth. Like everything is just so interconnected and intersectionality is such a huge piece of that.
So I think one of the things that, you bring up about when we do this deeper dive into understanding the client and the client's experience of their identifiers. I can remember one time was at a social activity, and for whatever reason, our faiths of origin came up, and I mentioned mine. I was asked, what was my faith of origin? I told it. The person actually looked and said, "Yeah, you look like you're that faith of origin." Now, what on earth that meant, I had no idea. And again, I thought, okay, yeah, we'll move on. So making these assumptions just because somebody says, "Oh, I identify as this or identify as that," making those assumptions is what does that mean to them? What do they take from that
Mm,
identifier? What adds value to their life? What takes away from their life? Looking at the nuances of that, and as you said, coming to the table with no assumptions, doing my work. I need to do my work. I can't rely on the client exclusively to do my work for me. And then leaning into the client's understanding of what of all of this actually is theirs that they claim, and is helpful to them. And I think that's just so powerful and so profound.
beautiful. Yeah. I think another piece of cultural responsiveness is just being aware of how, even in the field of counseling, like our ideas of self care and well being may differ from their own ideas of self care and what that means to them. So I really like to learn more about the research of like community wellness, community self care plans as well. Like how can we incorporate their family into wellness plans? I know with many of the Latina communities that I work with, family is such an integral part of who they are, and so I invite the family members to kind of write these self-care plans together and how can we, use the family to support them. And also some of the self-care, initiatives that we kind of talk about, lots of times when we talk about self-care, we say, you take a clean bath or you can go to the movies, right? You can go out to eat a restaurant. Like those are some self-care things that we think about. But I think back on, a couple of the clients that I've worked with who, when I first started out in my career as an intern at a mental health authority, and I was working with a couple of clients who were from a low SES background. And I realized that in suggesting some of these things that they could do for self-care, that it was definitely destigmatizing this idea of self-care for them, right? They straight out told me, I'm not able to do that, right? I'm not able to go out to the movies. I can't afford that. So
Mhm.
that really made me aware that I have privilege in that area of thinking about self-care in that way. And so we really need to adapt and be more responsive to what self-care could look like in their life. And like you were saying, Dr. Fisher, what is the meaning behind self-care for them?
Mhm.
Because that is the most important part. If they can engage in some of these activities and exercise that we're giving them, but if it doesn't hold any meaning for them in their own personal lives, then it's really not going to be much help.
No, and I think I really love the idea of talking about as a family, self-care as a family, because again, as you point out, for many individuals who identify as more of a collective community, more of family is greatly meaningful in who they are. Giving them something like go get a mani pedi, whether even if they could, the finances are there, that's not meaningful.
Right.
That doesn't feed their soul.
Mm,
And so I think that's a beautiful way of inviting, what is meaningful to the client? What does self care look like? What would be nourishing? Even the phrase self care can have its own stigma in
mm,
communities, right? I've got so many other people who need me, and that's part of my identity, and it's a part that gives meaning to my identity. And so what does that look like? So yeah, thank you for bringing that element of family into that planning.
yeah, of course. I've worked with clinicians, and there was a clinician I can think back of where, maybe they didn't hold that awareness for, how important the family was in their clients' lives. And so, that clinician was just having that conversation with me, trying to learn more. And they gain an understanding of how when they told the client, it's okay, you can be selfish, right? Like you can engage in self-care and your family can be in the background for a bit. They came to that realization that that was actually, invalidating kind of the importance of family in their client's
Yeah.
life. And I was really appreciative of that counselor just wanting to learn more and like, see the importance of family. But I told that clinician, it's okay. I think all of us can do that sometimes and we can hold that privilege in sessions. And that's
Yeah.
where that reflexivity happens. And we're consulting with everybody, around us and we're seeing like, okay, where can I be more culturally responsive? So they went back to their client and said, no, it sounds like family is important to you. So let's incorporate them in your self-care plan. Let's not, put them aside. They have to be in there.
This is powerful. This is some powerful stuff. I really appreciate you sharing this because we went from the research piece to the clinical piece. As a supervisor, you sharing these experiences. The theme that I'm hearing that's really important, because Dr. Fisher, you brought this up as well, and Dr. Diaz, the assumption that people have and they place on us. The theme that I'm hearing is your willingness to see privilege or see the things and then decide, I'm going to use this information to help me get better and go back out here and do something different. So what I'm hearing, and I quote, do my own work, or doing your own work. What does that look like for clinicians, again, from newbies to those who've been in for years? How can someone begin doing their own work related to this topic?
The first part is really knowing yourself. This kind of like, in my opinion, like knowing yourself, knowing your own social identities, like getting really comfortable with who you are as a person, what social identities that you hold really near and dear to your heart. What are your family traditions? What's part of like your culture? Just because that in itself is then going to play a role in the counseling relationship, in that dynamic, right? And what it's going to bring up for you. What are the emotions and, thoughts that are going to come up for you when a client is disclosing, their social identities? All that plays a role in the relationship. And then your identities inform what you're passionate about, what you go out and advocate for out in the world. But that can also create bias, right? Because how you grew up, who you grew up with, what you listened to, what you learned about, like all of that creates bias. Bias is something that's really common. It's something that I think will always be there, right? And so we're always trying to challenge our biases and our assumptions. So I also really like to, in addition to getting to know who I am, right? Like getting really close to my roots, talking to with my family, like learning more about who I am. I love to read research. I love to go out and, get engaged in different organizations, volunteer, attend conferences, learn from others and what work that they're doing. The Association for Multicultural Counseling Development has some great resources on their site. Counselors for Social Justice does amazing work, advocacy work, legal work. ACA has the American Counseling Association, for those who don't know, the ACA has a whole website just on like social justice and mental health, different journals that are dedicated to multicultural counseling. So I go out and I see, okay, what are some of the recent research articles, the recent initiatives that people are working on, so I can get better informed and kind of gain that knowledge. Because again, we're always lifelong learners. We don't always know everything. So, things are changing, interventions are changing. That's one part, like educate myself. I really want to make sure I'm educating myself. And then relying on my community. So relying on people like you, Dr. Branch, Dr. Fisher, like the MACC community, like people in the field who are doing the work, and say like, hey, what is an article that you just read about? Like, what is something that you're really passionate about? How can we learn more about this particular field? What are we doing within our counseling program that can improve, right? And can be more culturally responsive to our students? Always like inviting those conversations. And also being okay with being uncomfortable and having some of these conversations where maybe I talk with people who have different points of view than myself, and being okay with that and kind of like engaging in that conversation and that dialogue. So being okay with difficult dialogues, and getting okay with being uncomfortable. That's, I think, something that's so important. Like I always tell my students, like get into that literature, learn more about yourself, learn more about the research. It's imperative.
So one of the things I just wanted to kind of put out there and get some feedback from you, Dr. Diaz, is last year I was part of an initiative, a statewide initiative, Colorado, something that Alliant Educational Foundation is a part of, is looking at creating a mental health toolkit for communities in the state, right? The idea is to get this toolkit out to the communities where individuals are, and to have not just providers be accessible, but the educator, the teacher, the coach, just anybody could have this toolkit. And it's in the process of being edited and whatever and piloted. What's kind of your thoughts on these kind of community mental health toolkits?
Oh my goodness, I love that.
Yeah.
That's a great idea. That's so funny that you're mentioning this, Dr. Fisher, because I always talk about our clinician toolkit
Yeah.
in my practicum and internship courses, but also in other courses. And I give so many resources to my students, probably to the point where they're like, please stop posting all these resources. And that's totally okay. I say they're supplemental. You don't have to read through all of them because our students are busy. They have a lot on their plates. But the reason I do that is because in my career, I have binders. I used to have a whole binder, right? But now I have, a folder on my computer, and I have a little rolling backpack with different activities and exercises. And it's all so helpful to have like all of these resources in one. It's like articles, organizations, legal resources, housing resources. insurance resources, like all of these things, because lots of times like we're just not connected to a lot of this. We don't know what's out there. We don't know what's available. Like I can think back on a few of my clients within universities that they didn't know that there was a food pantry on campus, right? And they were really struggling with food insecurity. And so I had like all of these resources available, and I would always give my clients like, this is a list of resources. You may not need them right now, but just so you know, this is available to you. So I am a big, advocate for resource toolkit. So even if you don't think you need them at that point, have them. I think now I'm in the mindset of, my students will have all these resources to work with clients, but I always stress that it's important to then pass on those resources to their clients and to colleagues around them because they need the resources more than we do a lot of times, right? They can go on the websites, they can go and learn more about their anxiety and about their depression. We want to empower them to do their own work and have that autonomy to learn more about what will help them and what will be helpful to them. Like we don't always want to assume that we just have the answers and we're just almost like
Mm.
gatekeeping resources.
I love that. I love that. What I'm hearing a lot of enthusiasm in your voice and this idea of empowering the individual with everything that's out there, that we don't have to be the holders of the truth, so to speak. And so that these community toolkits, so Alliant, if anybody's watching from that committee, um, so that these toolkits really can empower communities to empower the individuals in their communities. It doesn't have to come from a licensed professional. I
Yeah.
love that. Thank you, Dr. Diaz.
Of course. As you all know, one of my colleagues, Dr. Asal, and I have worked on a professional resilience toolkit. And so we go and present it at conferences, and it's basically how we can promote resilience with our students in culturally responsive ways. And so we have a number of activities that we do in our supervision courses and our field courses, presented to other people in the field so maybe they can go and take it to their supervision courses, right? And I know many of us within the field do that, and we have these types of toolkits and just a range of experiences, a life experiences and professional experiences that then we then share out and like disseminate. But I often think lots of these conferences are very much, centered on people within higher education, right? Maybe there's a couple, like the ACA conference invites more clinicians, but sometimes I think like going back to like that ivory tower, right, where all of us are kind of in higher education, we have access to all of this. I think like we really need to make sure, like you're saying, Dr. Fisher, then a lot of us are going out into our communities and the organizations and taking these resources, maybe offering, a conversation or a dialogue or a presentation on these, or just sitting with people who are, leaders in these organizations and saying like, what do you need? What are some things that would be really helpful to you all? Just because I think there can be that disconnect between, our counseling field in higher education and those clinicians who are actually out there doing the work. So I just think that's so important to then go out in the communities and give this research as well, right? We don't just talk about it within our own research community.
Yes, spread the word. I love that.
Yes, indeed. We in the kitchen. So you in here cooking, okay? We are in the kitchen and you are cooking. Before we get out of here, I'm curious. This could be heavy. This could be a basement question because everything that you're sharing is a lot of work. And this is a lot of work that's not even related to your job description or your actual responsibility. This is, the micro work that we're doing that helps us on an impact on a large scale. So I'm curious for you or just marginalized communities, how does someone not burn out or lose themselves or take care of themselves while doing this heavy lifting, changing systems and structures and ideas and biases? Like it sounds like a lot of work. How do you manage it? How do you stay sane in all of it? Just curious.
Oh, this is a topic that's so important and one that I almost did my dissertation on for bilingual counselors in training who are out there doing the work, who are basically working as not only clinicians but translators, right? And having to translate resources, materials, intake interviews, treatment plans, theoretic orientations, and translating into a whole different language when there's such limited resources in Spanish. So many times I can remember, having probably 80% of my caseload when working with Latina clients were, Spanish speakers. Going into a field, I think that's like mostly kind of English based, and there are not many resources in Spanish, not even books. I mean, there's a few books, which I was really thankful for and I, got. And there was definitely some supervisors who were bilingual who were able to help. But even then, there's such a shortage of bilingual supervisors. And so a lot of that like work, that mental load and that emotional kind of load fell on me as an intern and, now as a clinician. And I know many of our students are also struggling with that same thing. And, I try to help with that by meeting meeting with our students and, providing them with resources that I received as an intern so that way they can feel like they have more access to different resources, or just can talk about it and have a safe space to talk about it with a professor who maybe understands. That is all really important work. And it's also really, really, like you said, Dr. Branch, hard work, because we're so passionate about helping our communities. But that also comes with its own level of strain. And it's not just in the Latino community, right? Like other BIPOC communities, BIPOC counselors are also experiencing lots of these like emotional challenges and burnout and compassion fatigue, because they are the ones that are, working hand in hand with BIPOC communities and providing them with these resources and just like these safe spaces to talk about different things that they're experiencing out in the world. All that being said, is I think what kind of fuels my cup is honestly my students, like just sitting down with them and knowing, that there are people who genuinely care about, this work and this field, and they have a genuine love for this field and for mental health and mental well-being. Yes, it's all really challenging, but if we don't go out there and do the work, right? If we're not out here learning and being there for our diverse communities, then who's going to do that work, right? So it's a very tough balance, because all that kind of creates those challenges also is what is the most rewarding about my work as well. So yes, being a mentor and, being a Latina in higher education is really, really hard, but I kind of lean into my resilience, into my roots, into my family. And I kind of think back like on Latina young Ashley in school. And I look back at her and I say, this is what you wanted to do. And this is why you're doing this, because you were that person who needed, that support and that help. And you saw others who needed that, and we didn't have that many times, and so I want to be that then for other kiddos, other clients, other people who are struggling out there. So anyways, that was a very long-winded answer to that.
This is why we're here. We asked for it. We got time. We got time. So before we leave, are there any final thoughts or anything that you feel as though the listeners need to hear? What's important? Because everyone doesn't have access to these types of conversations. And this podcast, expectantly, it's designed to help people see things differently. In my opinion, I'd like to summarize real quick, three things. There are 3 types of therapists, 3 types of clinicians, educators, you name it, 3 types. And the 3 types is horrible ones. We ain't got to talk about them because everybody already talking about them. You got good ones, which just do enough, just do whatever you need to do. And then you have great ones, which I feel as though everyone in here is great because you're willing to do the work on yourself. That's what sets you apart from everyone else. What recommendations you have for people to consider shifting when it comes to social justice or doing things differently or making an impact based off of what they can do? Because as you said, we can't do it all. We don't have that ability, but I can do something. What are some things that come to mind for you that people can begin doing as soon as today to begin changing or shifting things for our profession?
One thing that I can really think of is that's like crucial is, again, getting to know yourself, like going home and like just asking yourself some reflexive questions, right? Like, what makes me who I am? What are some social identities that are important to me? How did I get here? What is it that drew me to this field, right? Just starting to get a sense of who you are as a person, talking with your family members, just getting a sense of like who your family is, your traditions, like what brought you to this field and how you want to make a difference in this field. And then making small, like incremental changes in the session, right? In your interventions, like even just reviewing a treatment plan or your intake interview and saying, how can we talk about culture? Like sometimes it's really scary. And I think the reason that students are scared to bring up conversations around culture or even, commit a microaggression or say something that, might not land well with the client or may even be offensive to the client. The reason is because of that fear that then you're going to rupture the therapeutic alliance, right? Or maybe you're going to say something that the client doesn't really like and they're not going to want to see you anymore, right? Or it's going to cause some sort of conflict. But I think if you're willing to say, hey, I'm so sorry that, that offended you. I want to be better. I want to learn more. I'm here to learn more and I will do my own work outside of session to learn more, but I really want to work with you and I want to get to know you more. Usually clients are really receptive to that, like if you're willing to apologize, take accountability and then just move forward and try to be better the next time. Many of clients just want you to be present and to acknowledge that. And that I think shows true authenticity. All that being said is like, yes, they have, that fear is very present, but you need to push yourself to be uncomfortable in these dialogues and then still have them, right? And still be willing to engage in these difficult dialogues. When you kind of work through that fear, work through who you are, and now you can start getting into, okay, how does a treatment plan look? How does this interview protocol look? What are even the questions that I'm asking that I can make more culturally responsive, right? More attuned to what the client needs. And my space as well. How can I make my space more inviting, more safe for clients? I can think back, a couple Latino clients who were struggling with grief and they were wanting to honor their loved ones. And so I asked them, like, would it be helpful for you to create an altar just like you would, like maybe in Day of the Dead, Dia de los Muertos? And they said, yeah, absolutely. And so I brought in materials, we kind of made that and we had an altar for them where I could bring it in session. We could talk through that grief and learn more about their loved one and honor their loved one. So that's a way that I kind of created like an environment where they felt, good about talking about grief. It's just so important that we make these, like, there's just small, like, incremental changes that we can make in different ways to make our clients feel safe to talk about who they are.
Okay, you just brought something to me. Good. Woo, you cooking. You cooking. Okay, I'm going to shut up in a minute. Dr. Fisher, I would love for you to share any final thoughts. I'm curious, Dr. Diaz, where did you develop this level of confidence and courage to do the things that you are doing and that you have done to be where you are? Where did this come from?
I think it's two-sided. So on one-sided, sometimes I didn't have those spaces where I felt like I could be myself and talk more about my culture and be who I am and bring in traditions and who I was, right? But then on the other hand, I also did have, some spaces as I went into like my master's program and my doc program. I had some spaces where I truly felt safe, right, with people around me or mentors who really tried to kind of have those opportunities, or ask me about who I was, what was my favorite food growing up, in a border city. So it's almost like that lack of made me passionate about making sure I was creating these spaces. But then I emulated some of those conversations that I had from those mentors and people around me who were willing to have those conversations. And I said, I want to be like that and I want to create spaces like that.
The only thing I can really say is from where I sit, in the space that I sit and what I take in, my role is to do just that. Listen. Just listen. That is one of my takeaways, right? Is that those of us who are in this place of privilege, fish doesn't know they're in water. And so sometimes we don't even know we have that privilege, that just to go in, right? We just don't know. Go into that space and with the idea that I'm just going to listen.
Hmm.
I'm going to let you tell my story.
That's the difference between a horrible therapist and a great one. Just listen. Dr. Fisher, mic drop. Mic drop. Dr. Diaz, any final thoughts before we get out of here for today?
I think throughout kind of this podcast, you can tell I shared a lot about who I am and like what kind of pushed me to this field. And that's what I kind of want to like leave with, is knowing that there's a huge part of like my family background, my cultural background, my environment that I grew up in beautiful, positive, celebratory ways where, there is systemic oppression and there's also beautiful, prideful things that we need to celebrate about a person's culture, right? And so all of that informed who I am as a counselor educator and as a counselor. And so I kind of ask, other clinicians to tap into like who they are. And yes, there are systemic inequities that we need to continue to challenge and, we need to advocate. And also advocacy looks like celebrating a person's culture, being proudful about your culture and not just focusing in on the negative. And so in session, if you find yourself always just kind of focusing on the negative and, what are the bad things that are happening and what are the horrible things that you're experiencing, also make sure that you're making spaces, celebrate a person's culture and ask them like, do you want to bring in, something, a food item that's really important to you, right? We want to have like a potluck, right? I used to have a potluck when we were all in person. I was teaching in person for my students who are in internship. I would say, bring in a food item that like just really represents who you are and your family traditions. They would bring it in. We'd all like share food together and talk about our cultures together. So that I think is just so important. Like also celebrate the beautiful parts about our cultures.
Excellent. Thank you so much. Thank you so much. This has been another phenomenal episode of Inside the Session with myself, Dr. Branch, Dr. Fisher, and our amazing guest, Dr. Diaz. And I wanted to leave you all with a phrase or statement that you said, Dr. Diaz, that I think was so important. This language is what I would love for us to use for our title, which you said, cultural wealth.
Mm,
Culturally wealthy. That's who we are as humans. We
mm,
are culturally wealthy. Dr. Diaz, you just came up
absolutely.
in our kitchen and made it real hot. So we finna get out of here. Much love to you. Much love to the listeners. Much love to you all. We will see y'all next time. Have a great day. See you
Thank
later.
y'all.